Welcome back. This is Mark Parkinson, and I'm back with Dr. David Gifford. And Giff and I are going to talk about the continuing challenge that we have under the COVID crisis. And in particular, what should we do once a COVID is in our building? What can we do to keep it from spreading? We know it is still an incredibly tough time. We hope that as a country, we're kind of at the peak of cases right now. Hopefully, we'll start getting some good news. But unfortunately, the news has not been good in our nursing facilities or our assisted living buildings. Hundreds, maybe even in the low thousands of buildings across the country now have either COVID positive residents or COVID positive employees. The best of providers have these cases in their buildings. It is not a black eye. It is not anything wrong with what you're doing. If you have COVID in your buildings, it can happen to any of us. The question then is, what do we do once it happens? And Giff is here to talk about, once it's in the buildings, what are some of the key strategies that we can take to keep it from spreading? Giff, what would your advice be?
Thank you, Mark. Well, I think we know that this virus spreads person to person, and we know that many people who don't have symptoms can spread the virus. So it means really trying to reduce the number of times different people interact with each other. And that's not just staff with residents, but staff with each other. And so some of the spread that we've seen is because it's spread from staff to staff as well. So the social distancing between the staff is important. Figuring out how to bundle care for the residents so you don't have multiple people going into the room with the resident, but fewer. We have seen some circumstances where the spread has been amongst the staff, but not amongst the residents, because everyone's doing the right thing with the resident, but forgetting about the staff. So I want to remind people that this is about spread, but it is, as you said, very hard to prevent this.
And we have a couple of different resources on the website that specifically talk about how to keep this from spreading once it's in your building. Why don't you just talk about what those two resources are, Giff?
So we both have some ideas and suggestions on what I just talked about with decreasing the interactions. But we also have guidance on how to create separate wings so you can keep residents and keep staff there. And so they aren't mingling between each other, try to prevent staff from going from unit to unit, floor to floor, but how to create these separate wings or units. And that is a push from both the CDC and CMS to move in that direction.
Great. Well, I'm sure it'll be helpful for our members. And, you know, just to end this on one piece of good news, a facility that is obviously very good at handling COVID once it's in the buildings is one of the Oregon Veterans Homes. And you know, we have the real honor of representing veterans homes across the country. They're some of the very best providers across the country. Some of our gold winners have been veterans homes. In this particular building, a 104-year-old resident got COVID and survived, becoming one of the oldest survivors of COVID across the country. And so what's remarkable about someone that's 104 is that he survived the 1918 Spanish flu pandemic, and now he has survived COVID. It's just an amazing and inspirational story and shows the phenomenal work that our members across the country are doing. So our thoughts continue to be with you. We hope that we are being a great resource for you as we get through all of this. The numbers are starting to look a little bit better. We may be more than halfway through this first major immediate crisis, and we're going to be with you every step of the way. Thank you all very much.